Welcome everyone to the next episode of Impactables with Rishabh. Today we have Vaibhav from Portea, the largest home healthcare service provider in India. Welcome.
Thank you.
So it is great to know that you guys have built the largest home care healthcare assistance company actually. So why this idea came through? Because you have been working in the industry for 25 years across sectors, and saw that from different sectors to this. What was the journey?
So Portea, of course, started, as I mentioned to you earlier, Portea started in 2013. And the whole idea at that time was that if you look at healthcare in India, the healthcare in India was really world-class from a corporate hospital perspective. So some of the best hospitals like Manipal, Apollo, Fortis, and many others, they are present in tier 1, tier 2, tier 3 cities and have been providing really world-class support and medical care. And that's how you see medical tourism to India growing up as well. But when patient got out of the hospital and they want to go home, the service level was not at the same level and not of the same quality. So we looked at what we call outside the hospital healthcare market and realized there's a still big unmet demand to convert unorganized segment of home healthcare into organizing it, and that's where the whole idea came from. Our promoter Meena Ganesh had a personal case also where the home care was required, and of course she saw it through her own eyes and her own experience, and that's where the idea came from. And from then, of course, we have been building service by service, step by step, city by city, and looking at how we can really organize this segment, provide the world-class quality of service with the right level of reliability and availability to the patient in their homes.
So what is the major segment which you guys cater, like in the home care? What I know is like biggest demand might be for nurses, I believe. For you guys might be the same.
So what we look at, and this has been an interesting journey also, is that we look at every single medical care which can be done at home. We want to provide that.
Okay.
So it starts, of course, from as complex as setting up an ICU at home. So many times a patient will discharge from the hospital either for end-of-life care or for rehabilitation where ICU-level care is required. So we'll set up the full-fledged ICU at home, as complex as an ICU, which is basically including ventilators, doctors, round-the-clock monitoring, and rest of the equipment and so on and so forth, to as simple as picking up a blood sample from home actually. Okay. And the all range of services through that is nursing, caregiving for elder care, basically chronic disease management, physiotherapy, primary care, doctor visits. So the whole idea is medical equipment. A big part of our whole service offering is medical equipment, because many patients require medical equipment after the discharge from the hospitals of varying degrees, from BiPAP to oxygen concentrator to wheelchair, beds. Those are very important things. So the whole idea is that when a patient is at home, any medical care he requires, we should be able to provide the complete range of services. From size perspective, of course, nursing and caregiving are the large ones, both from post-operative care perspective as well as from elder care. You know, India is a growing elder care market. India is close to 13-14 crore, 60 plus people now, which number will come 35 crores in 2050. So India will have like a very sizable elderly population, and the need for the right level of caregiving for them is only growing as this grey economy is growing in that sense. So I think those are segments which are the larger ones.
Any interesting scenario happened with you guys also where you feel that, you said as a personal story, you mind sharing some kind what happened actually and then led to start actually?
So from my perspective, of course, it didn't happen when before we started. But for me personally, my father was a dementia patient. He had dementia for 4 years, and and of course he progressed over a period of time. The disease progressed, and we supported him with Portea attendants around the clock for 4 years in my house in Lucknow. Of course, my mother was a primary caregiver, but we had 2 attendants from Portea around the clock. Really taking care of a dementia patient is probably one of the toughest thing from an elder care perspective. And that we did. That's my personal experience. My own in-laws have been elder care patients for Portea. They use our subscription plans to take care of their health, because variety of services which you have set up, of course, get used by elderly quite a bit, both in terms of peace of mind, not only for them, even for their children, right? Because they know that, especially for a lot of migrant population in this country and abroad. You know, India, there's a lot of migrant population. People like both me and you are migrants in that sense, right? There's a large migrant population which has also gone abroad. their parents are here alone, somebody has to really take care of them, and that is something which we do day in and day out for our patients. I mean, it's another number. At any point in time, more than 1,000 patients will be managing, where we are the only one staying in patient home along with one single patient.
Okay.
So the spouse has either passed away or is not there, and so single person will be managing. The only second person in that house is our caregiver or our nurse. There are thousands of patients like that in a month we take care of.
There is a huge matter of trust also.
It's a huge matter of trust. Yes, you're absolutely right, because every single thing of that patient has to be managed by us, and we do that round the clock, and have served. Apart from that, of course, interesting points, we have served who's who of this country, from the first citizen of this country to who's who of your celebrities. We have served over a period of time, including politicians, film stars, and so on and so forth. So yes, given that we have been, over a period of time, we've been able to build a good brand, trusted brand, and with that, there's a lot of good work which has happened and will continue to happen.
How this cycle goes on, like from a person who, if I need a care assistance for my mother, say suppose, when I book a particular nurse for this person, so that nurse, what the qualifications the nurse will have in order to get on your platform?
So there are different services for which the qualification will be different. So like physiotherapist, nursing, they will be qualified. So when somebody is looking for a nurse, they will either GNM or BSc nurses who have a full-fledged professional degree, and of course relevant experience, given that we serve very critical patients also for oncology care, for neuro care, as I said, for dementia. So a lot of these things are very, very specialized care. So people not only need to have the right degree, they also need to have the right experience for that, and all of those things we take care of, making sure that the right person is being sent or being put for the service. So that is, the profile matching is very important basis what you require. Second thing which is very important is that this particular service is a medical service. So a very, very strong medical layer has to be there on top of the person who's coming to your house, whether a caregiver is there or nurse is there, physiotherapist. There's a battery of support available at central level from a subject matter expertise perspective. So we have all the critical cases are overseen by a doctor in our company. All the nurses work with the SME regularly. All the case files of critical cases get reviewed every day, and the treatment plan gets created along with the treating doctor when we take over a case. And then the team will continue to make sure that as per the treatment plan, we are continuously offering the service and continuously modifying the treatment plan as the condition improves, and of course be in regular touch with the treating doctor. So there's a full the full SOP is there, standard operating procedure is there for each of the critical areas which we manage, and the team follows that and manages patients accordingly. Another thing which is very important in this particular thing, given that we are present countrywide and manage all different kind of patients, is also very, very strong layer of technology. So all our clinicians who go to patient homes carry an app. They basically connect with patient regularly. They create their case files using the app. All their operational parameters are tracked using that app. And the case file which get uploaded centrally get managed, get reviewed, get interacted with. The video consultation is quite prevalent, where a doctor or a senior physiotherapist or a nurse will be continuously talking to the patient and managing that. So that is something which we do. So both from medical perspective as well as from technology, very, very strong layers are available in both these areas to make sure we're able to offer a very efficient, seamless, and very, very effective service for the patient. And it's really healthcare. It happens in patient homes. So trust is important, medical expertise is important, patient getting better is important, the treatment plus adherence is important. So all of those things we ensure using a good combination of medical knowledge and technology.
Interesting. So now we have understood like what you guys do, but now let's talk about the market overview, like how. So in India, like how big is the healthcare market?
So healthcare in India is a growing need. Of course, different segments or different reports will give you different numbers. There's a hospital market. There's a need for what we call primary and secondary care and tertiary care. Then of course you have need for diagnostics. You see that particular segment, and pharma. So healthcare is a fairly large ecosystem. Just from home care perspective, this could be anywhere between $30 to $40 billion.
Only in India?
Yes.
And like how is it growing over the years?
So it's growing anywhere between 8 to 12% year on year in the last few years. And of course, still a large part of this is still unorganized. It's very, very unorganized. But the whole idea is that over a period of time, a good combination of elder care and home care will probably help to provide patients right level of care, right quality of care, and of course organize the market as we go along.
And this home care actually, as per your experience, like such a decade-year experience running in this, where is the most number of demands, like in metro cities or like tier 1, tier 2, and what kind of people usually take this? Like,
so this of course need is there in all kind of cities, because end of the day, elderly are there in every city, and post-operative care where patients go for surgeries, they discharge from there and require it everywhere. Of course, metros are the big markets, given that healthcare is concentrated in many ways. The top hospitals are in all the metros, mini metros. But I would say in today's India, a lot of good corporate hospitals, and that's a good surrogate for people using home care and being willing to pay for quality home care will be corporate hospitals. So wherever corporate hospitals are there, I think the propensity for patients to pay for good quality healthcare is high over there. So I would say metros, tier 1, tier 2 cities, tier 3 cities also are covered, like cities like Ranchi, cities like Patna, Lucknow, Chandigarh, Jamshedpur, Coimbatore, Salem, Mysore, all that range of cities. So I would say around 120 cities in this country will have strong demand for home care.
Interesting. And like you might be the largest employer of home care assistant people also. Like, can you tell us like how many people are employed currently? And
so right now we would be having around 5,000 odd clinicians who will go into patient homes and supporting them at any point in time.
Includes all categories.
Includes all categories actually. So these are people, they will either staying in patient homes or they will be visiting patient home also. So like many times for nursing visits where we do IV infusion or vaccination, and physiotherapy will be where patient homes will be visited multiple times in a day. Different patients, the clinician will be going. Or for nursing or caregiving, they may be staying in patient home also. So completely around at any point around 5,000 clinicians will be out in the field. From caregiving perspective, in last 10 years, we would have probably trained anywhere between 20 to 25,000 caregivers and created that cadre in this country. Just for you to understand, when we started, we were the first one to look at organizing this particular segment. So we create this corridors of people from where we can get them to which cities they can go, how they can settle in those cities. We worked with government body, NSDC, Health Sector Skill Council very closely in terms of designing the programs, in terms of implementing the programs, in terms of hiring from their partners, moving those people to different cities. Because if you in India also see, a large population of workers will come from some states like Jharkhand and Bihar and UP and Rajasthan and so on and so forth. And they will go across the country to different states and cities where the needs are bigger also. So we have basically learned this over a period of time, what kind of corridors work for what kind of people, how can you move people to Bangalore, Chennai, Hyderabad, Mumbai, and so on and so forth. And we have built that over a period of time. So large number of people we have trained, create this cadre, got this whole segment organized in some small ways as of now.
Any government initiatives were also there in order to promote this kind of a thing, or government also have some kind of programs around it? Because in the things which is related to research, actually government pushes a lot of in medical segment actually. For this also, did government did any kind of initiative?
So government has this skill sector council where what we call GDA, the general duty assistants, these are caregivers. So government runs these programs for 3 months, 3 months programs where people get trained on GDA and they get a certificate after that. And this is basically the basic training for the caregiving. And then of course we train on top of that for specialities to these people and they basically go and serve the patients. So government runs this program large scale across the country. Of course, a lot of activity has happened post-COVID. So insurance is another big thing in this particular industry. If you see worldwide, home care is covered by insurance. So like if you see countries like US, UK of course has their whole program run by government, but US also, all the home care is covered by insurance. So in India, it has been mostly out of pocket forever. So I mean, if this segment gets fully covered under insurance, this segment's growth
is not covered yet.
Is yet not fully covered, and the first coverage started post-COVID. Just it's still it's a very nascent segment of healthcare, right? So during COVID, all the home isolation programs, the home recovery programs were covered under insurance.
Yeah,
so that's what government brought a mandate at that time. And post that, a lot of insurance companies have been looking at how they can leverage insurance to basically how they can leverage home care to basically support their patients in speedy recovery. So now we are seeing insurance basically baby steps in this particular space. I believe the next 5 to 7 years, as insurance covers more home care, you will see a lot more traction happening in this particular
Exactly, because people want to get this covered, especially for the ICU part, because that's a costly element. Rest of the home care assistance part might not be that much.
Both actually, I would say that for elder care also it could be there, but of course, as insurance companies see their own business cases and build this. But I would say that home care has become a lot more integral to the healthcare ecosystem post-COVID. Because during COVID, we realized that not everybody could be treated in the hospitals. I mean, we had, wave 1 of course was very new, so nobody knew how to treat the patients. In fact, during wave 1, we ran a lot of programs along with various state governments. We were the first one to launch a home isolation program along with Delhi government. It was the first program in India for home isolation. And after that, we served over 5 lakh patients in their homes as part of home isolation programs. We worked with 7-8 different state governments, including Karnataka, Mumbai, Chennai.
And this was during COVID?
This during COVID wave 1, wave 2. Then during wave 2, of course, oxygen was a big need. And beds were really scarce in cities like Delhi, Bangalore, and many other cities also. In fact, we are probably the largest supplier of oxygen concentrators at that time. We worked with many corporates, we worked with many other companies to support needy people. We ran a large program with HUL, which was called Project Hope, where HUL basically worked with us to create the capacity for oxygen concentrators, and we managed the whole process across the country. So anybody needed an oxygen concentrator could get it free of cost. It was basically us, NGOs, and HUL came together to create this whole program, which was fairly successful. So I would say that COVID made everybody see the value of what home care could do. And whether it is insurance companies, corporates, hospitals, as well as pharmaceutical companies, they all are looking at how to leverage home care more and more now.
It might be also a situation that during that time, you guys have got much more of inquiries, right?
Yes.
That was might be the largest.
Yes, it's a need were different at that time. Of course, your regular caregiving and this one was lesser. But the big need was there for managing COVID patients.
Correct.
How do you manage COVID patients, right? So you have to have what kind of SOPs we need to follow, what kind of people you can send, what kind of precautions they need to keep. It's something new which we could create at that time ground up. And as I say, it's a black swan event, but really helped to put home care in the mainstream of healthcare in this country.
While we talk everything, like one important aspect is also about on demand. Like, because there are certain things might happen very unpredictable situation, like people got stroke, people got heart attack, people fell down from somewhere. Do you guys assist in that particular part also?
Yes, we provide emergency care as part of our services. So of course, wherever our clinicians are there on ground with the patient, their emergency care is totally taken by us because our people are there with them. And in fact, you are asking interesting incidents. Many times every month, at least few cases which will happen where our caregiver or nurse has saved the patient life. In one case which happened a couple of months back in Bangalore, we are supporting the mother, and the father had a heart attack, and our nurse understood that is a heart attack. She took him to the nearest hospital in the what we call golden hour and saved that person's life actually. And many incidents like this will happen through the month, where they'll do CPR, whatever is required to make sure they revive the patient or take care of the patient. Other than that, if we also, as part of our elder care programs, we provide emergency care, where patients can reach out to us, and we basically work with our network of partners.
And if in case you guys are not connected, like suppose if I am the first time customer, but someone got heart attack very suddenly, do you guys provide that assistance also?
So if you reach out to us, of course we don't do that ourselves right now, but we'll do it for you through our partners.
So like for you as an individual now, because understanding this sector might be, because I don't think you are from this similar background now. You're not from the medical background. You're from different industry as a whole, worked in different industry, coming to this sector.
Yes.
Because like I was an engineer, but I do something similar to that, but now I'm a different sector as a whole. For you, what was that particular phase of your life?
So for me personally, of course, I have built big businesses before this. That has been my journey. And coincidentally, I have built businesses where large scale workforce is required. So in my last company before that, we had a BPO company, which was again first of its kind in the country, and we used to provide tech support and financial services support to the US companies, and of course many Indian companies as well. This company was almost 4,000 people in its peak before it got sold. So my journey, of course, has been of taking new ideas and taking them to market and building that. So of course, when the idea of Portea came and we got together to build this organization, the same principles were applied, actually, saying that how do you create a large scale services company, right? And large scale services, of course, is very more tricky because it's healthcare. So, and that's why I was mentioning to earlier, saying that what are the most important critical success factor for building something like this? Those will be having the right set of people, building the right brand, having very, very strong technology and medical care. So how do you have medical expertise, technology? So how do you get the critical success factors together? How do you make sure that those are baked into every single thing which you are doing as an organization? So that's something which we have focused a lot in the first few years, especially. And how do you create the right standard operating procedures, right? Given that the hospitals do that. So every time when we started, a lot of our SOPs got created along with the hospitals, from where we were getting patients, right? So we'll work with the treating doctor and along with them create those right SOPs for how that patient should be treated at home, actually. So whatever expertise was available with our partners, and of course we built a very, very strong medical team within the company as well, very strong technology team within the company to make sure we are able to provide this at a scale. See, in our case, if you see in a home care perspective, it's a many-to-many problem to solve. Our clinicians are not staying with us. They are in patient homes. They are in their homes, go to patient homes. Our patients are not in our premises. They are in their homes. So how do you make sure that patients are taken care of? How do you make sure clinicians are taken care of? They're connected to the company and they are serving patient the right way with the right medical knowledge, right medical care. That's where creating the right connect with them, creating the right technology layers, creating the right medical supervision, all those things became very important. So for us, understanding what are the critical success factors, putting the SOPs together for that, and making sure we are following this relentlessly. Other important thing which has worked very well for us, and that has been my personal learning as well, is that we have listened to our patients continuously. For first 2 years in our any feedback which patient gave, what the positive comment, negative comment, anything they put, any of the social media, we let it be there, because a big reminder for us to learn from there and correct ourselves, right? So listening to patients, again, something which has been very core to our the way we operate, and even today we operate the same way. See, it's a large scale medical care in patient homes. There will always something, and this is people driven. There will always very small percentage of cases which can go wrong, because it's people who are coming to your home and taking care of it. And at the time, of course, your agony is understandable, because fact is, it's like your relative, your parent, your son, daughter, who is going through that pain, right? And for us to make sure that we learn from each of those and make sure those kind of things don't repeat is very, very important. So listening to patients is very critical. Today, almost 27-28% of our patients, new patients, come from referral. Okay. That's a big testimony to the kind of brand we have been able to create, the kind of trust we have been able to create with our patients. So I would say that has been our journey in building it. Other thing, I think innovation is something which we have been very, very keen on, because this whole landscape has been changing as we have gone along. And so what kind of services to launch, how to run those services, how to make sure those services are optimally run for the patient, or the most efficiently run for the patients, and of course providing the right outcomes for them as much as possible is something which we have focused on a lot.
Interesting. But building in 2013 and now building in 2025, like, since market has changed a lot, so how difficult it is to build a healthcare company in India now? And can it grow like over the night or over 1 year, 2 years, or someone needs to put a good time in this?
So healthcare is something which you probably do as it's like a test match. You play it in 2 innings. Actually, you don't play it in 1 innings. We like a lot of startup thinking is about 2020 or 1 day. But I think healthcare is test match, probably played over not even 5 days, played over 6 days, right? So it's like you play multiple innings and you play out play to your strengths. You learn along the way, you keep patience, you keep growing. But I think it's a long-term play. And it's very important to build it the right way, because it's end of the day, you are dealing with people's health, right? So it's very, very important to build the foundation very strong, because without that, you cannot do much in that. It's not a short-term thing. It's a real long-term play. And anybody who's looking at getting into healthcare and building a new startup should budget for that kind of time frame. It's not something which will come today, tomorrow become very successful and can go somewhere, because that's how the market is. That's how the consumers are. Healthcare gets built around credibility credibility takes time to build actually.
Correct.
Trust and credibility takes time to build actually. So that is something which I would advise people to just like come with a test match mentality and not T20.
Among all this, like what are new technologies or future medtech companies you are seeing that this might come in India, this will solve a bigger problem? Like there are few diseases today also. Dementia, I think, is non-curable. Similarly, like dementia also, there are like few other diseases which is not curable. Do you think that in upcoming times, the research which is being carried today might impact all those diseases in future?
No, of course it will impact. I would say that a lot of good work which is happening in healthcare, and if you see last 10-20 years also just from technology perspective. I mean, my brother had a gallbladder operation which was done with with a hole in the thing,
Laparoscopy,
right? Laparoscopy, right? And earlier it used to be done with a full cutting and doing that, right? Today, the technology has become so seamless, and now we take it for granted. Like that, so many new technologies are coming in oncology, coming in other areas, which are making the procedures lot more easy to handle.
And also the timeline to recover also decreases.
Has become much shorter, right? So those kind of things which are there. I would believe that the most important thing which will happen in next 10-15 years is that healthcare will become a lot more personalized. Today, all your entertainment, your other activities have all become personalized, basically tailored to you. Healthcare is still not personalized in that sense. So now with data, access to data being there a lot more, and AI coming into play, I would believe that next 5 to 10 years, the personalization of healthcare will become very available, and your treatment plan will be based on your health condition. It's not a generic thing, and that is you can really create personalized care plans for everybody. That I think is the biggest change which you'll see from a healthcare perspective with all the technology coming into play. And we are seeing some bit of that happening today. I mean, today when the way you're collecting data from patients, the way you're using it, of course, it's a long-term process. It won't get done in a hurry. But I would believe that our children, maybe 20 years from now, will look at healthcare very differently than what we have looked at.
But when we compare this with currently, like obviously in person, a person being present in a home is always a bigger factor. But still now people have started making AI agents for different categories. Like one category recently saw for the longevity actually. People want to extend the life, this particular feature. This one is becoming very popular in India also. It is popular in US, but in India also I'm seeing this, and people build a lot of agents around this. For generic treatment also, people have built some agents. So do you see that also getting traction, and after that, from that second level is like the personalized care and how it will roadmap
so
to this?
Healthcare will always be hybrid model. I guess care cannot be fully technology, and given the shortage of healthcare professionals we have, it won't be fully people either. And you are seeing some of those changes happening in hospitals and at home also for the patients, not only in India, worldwide as well. And I would believe that will gain momentum as we go along. So there will be certain segments of care where you will require a person. A person is a must. Healthcare person is very important. Now, what kind of supportive layer that person get around himself or herself will continuously grow. And with that, you could say that severity 1, severity 2 could be managed with as part of technology and somebody at home as a primary caregiver. And maybe severity 3, severity 4 and some parts of severity 2 cases will be managed by an expert at home who will be supported by a very strong medical and technology layer. So leveraging technology or leveraging medical knowledge, you can treat patient much better than what you were doing earlier. So it's not so much one-to-one. You have so much of knowledge available from your central systems which you can use much better, even in case like home care like ours. So that is something which will increase. I think the hybrid, if you say technology was 2% 10 years back, probably technology will be 20 to 25%, 30% as we go along. Caregiving, people being there, working with them will still probably remain 70% of that, because end of the day you require somebody to treat you and take care of you. So that is not going to go away in a hurry, but yes.
Super interesting. So what do you like apart from working actually? I see you play golf.
Yes, I enjoy golf. I love singing.
Yeah, that also I saw.
I love reading. Yes, so some of those things, yes, I have been doing and enjoying.
Interesting. I was checking on Instagram there. I saw that you were singing actually. That was very interesting actually, because that is something which I have not seen founders doing it oftenly. Golf and everyone people play actually. Singing is one thing I see founders are not doing that. So that is very good thing. So last one piece of advice to the any founder who is building in health tech, because AI, everyone is giving some advice. This is one sector which is very enormous and also requires a lot of knowledge and time and patience. So what do you suggest to the upcoming new founders who are in the age group of 25 to 30?
So I would say two things, as I said earlier also. One is that, of course, when you get into healthcare, you get into healthcare for long term. Healthcare is not a short term play, it's a long term play. So when you come with the 10 years at least in your mind. I mean, 10 will become 15, 10 is unlikely to become 5 actually, okay, unless you get too lucky and your technology really takes off. And second thing, you look at solving the problems which are real world problems actually, because healthcare and anything else which you see, changing consumer behavior is the most difficult thing to do. It's not only for healthcare, for any industry, changing consumer behavior is very, very difficult, right? You can see it in e-commerce, you can see it in many segments in last 20 years where changing consumer behavior has taken its own time. Healthcare, it takes that much longer, especially in India actually, because changing consumer behavior is never easy. And people use healthcare when they need it. I mean, of course, there's a lot of talk of wellness and everything else which is there, but those things, changing consumer behavior takes its own set of time. So when you come for long term, look at a real problem as much as possible to solve, where you can provide tangible benefits to the customers, to the patients, to the consumers. So, and there should be a paying customer for that. For any of the idea which you're looking at, I mean, always, you cannot solve a need in my mind. You have to solve a real need which I have, more so in healthcare actually. So, I mean, when you come with an idea, think of how this idea will really solve a problem and who will pay for it. And this is a really viable business model. And of course, come for long term.
Interesting. With this, thank you so much, Vaibhav. It was amazing talking to you and understand about the healthcare industry as a whole, because this was the first episode in the healthcare segment. And thank you so much for doing this.